ensuring evidence-based practices, and sustaining trust without overburdening the community actors. So it is a missed but a powerful frontier. Remember, prevention is personal. Trust is the currency. Build partnerships, not just programs. Let's bring care where people really feel cared for. It's very important. Now, no talk on prevention can end without talking about so-called primordial prevention or the efforts in early life, which have been promoted by Professor B. Sheshaya. And this is the peri-conceptual period covering the first 1,000 days of life. The main aim is to improve the maternal health, the fetal health, and basically focus on the fetus for the future. And that was even the message of the WHO this year: healthy beginnings and hopeful futures. Otherwise, what we'll have? We'll have babies like this. Childhood obesity is one of the biggest problems, and it is rising at an alarming rate. Studies done in Delhi schools and Maharashtra schools have shown an alarming almost 20 to 25% of prevalence of obesity in childhood. So we need to take care of that. And this is a wonderful Hindi share by Gulzar, which says, "Khali pada hai mere pados ka maidan, ek mobile bachon ki gend chura ke le gaya." Which means because of the mobile, the children are so interested in the mobile, they are not playing in the fields any longer. They are not getting any exercise. So this is a wonderful thing which tells us the sad state of affairs. Friends, the battle against obesity and diabetes cannot be won in the boardrooms of the pharma companies. Getting drugs, 15% loss, 20% loss is all bullshit. But it will be won in our kitchens, dining rooms, schools, workplaces, along with public policy and trusted places. So this is where we need to put our attention. Thank you for a patient hearing.
Excellent, excellent. Virmani sir, I think you didn't talk about how to prevent, but we have given a different perspective. It says, what is it we need to do, where is it we need to go? That's a very, very interesting, it's a good message for everybody who is in the hall. And then I think you should go for the trusted spaces. I would like to give one example what we have done about 20 years ago. We went to the campus in IIT, that is Indian Institute of Technology in Chennai. We went to that. And then we detected about so many people having dysglycemia. We just educated them. Next year we went and again rechecked. Believe me, 68% reduction in dysglycemia was
Right, absolutely right.
So I think this community based, I think that can spread overflow to the other places as well.
We have been focusing on the wrong areas.
I think the message is that it should not be what to do, where to do.
Right, sir.
I think that's an excellent thing. I think it's a different perspective. I think trusted spaces. Excellent, sir. Thank you.
Thank you,
and you
sir.
also mentioned about the metformin and SGLT inhibitors and pioglitazone as well. Metformin, though DPP2 study differently told, Dr. Ramchandran study said that lifestyle modification and metformin are equal in converting the pre-diabetes to diabetes.
In fact, I have found pioglitazone is the best drug in prevention.
And then if you look into the Defranzo and Sundar Mudaliar study, where they use pioglitazone, 85% conversion rate has been reduced. That's one. Unfortunately, SGLT inhibitors, as of now, we don't have any prevention. But what we are seeing is that those people who had reactive hypoglycemia, when you're putting them, they're losing weight, reduction in insulin doses, and abdominal fat coming down, and they're doing better. So I think, thank you, sir. It's a very excellent show.
So the message, we have taken the different view on prevention. Of course, we all know here that we all know about prevention. Of course, my message is, for example, reduce polio drops. We are not in a position to collect all the less than 5-year-old children 20-30 years before. Now they have reached all the children. Similarly, the government should take initiatives. We all talk, keep on talking, IDF to this level. But as we all know, the disease is growing like anything. But towards prevention, towards early detection, unless the government takes efforts. Because through government we have achieved so many things. Waterborne diseases, plague or HIV. Without vaccine, with the help of vaccine we have tackled only 2 diseases, smallpox and polio. Remaining other diseases, plague or guinea worm, cholera, all those diseases without vaccine we have tackled. Similarly for diabetes, as we know, we keep on talking for more than 30-35 years, allowing the disease to grow all over India, all over world.
Yes. Thank you.
Come on. Hello, hello. Do dogs take sweets? Anybody have dogs in the house? Do dogs take sweets? Dogs. Pet animals, dogs, you know. Do they take sweets?
Our, my dog takes sweets.
Okay. Normally we don't give salt or sweet to the pet dogs. We don't give the dogs. So I have 3 dogs. The dogs never taste the sweets because we don't train them to taste the sweets. The message is that
Salt is more
why
dangerous.
don't we train our children not to give sweets up to the age of 5? Why do you train the taste buds to sweets? Now the contest is coming. Don't give salt till the age of 2 years. Till the age of 2 years. Don't train the children's taste buds to sweets and salts at a very young age. So they get trained to all sorts of junk foods. So today I had Jigir Danda being supplied here in a diabetic conference.
Sir, what you said is very pertinent, sir, because
Actually,
there is one thing called as
very prudent. I tell you, we give our children right from the day of the 2nd month, 3rd month, so much of sugar, so much of milk added with sugar. I think that should be the way.
I think very pertinent point, because there is one concept called childhood memory.
Yeah.
See, the way more you eat during childhood, you eat more even adulthood actually. That's what it is.
Because till the age of 1, the child with the mother's milk, after the age of 1, the child trains his taste buds to different acts of food. Why do you expose them to harmful foods? Don't give sweets to children. Please don't give sweets to children till the age of 5. We can definitely have a better prevention of diabetes more than all what we have earned enough. Because you have heterogenic, your appetite, your center in the brain gets trained to that. Yes, you get trained to that. I think, thank you Vijay for the...
Thank you, sir. We will move on to next
1
session.
minute, Dr. Paneer. Supplying Jigar Danda, that is just to test the doctors who are with diabetes whether they are taking or not.
No. You can take once in a way Jigar Danda, not every day, not 3 times
That is
a day.
doctors,
That's okay.
doctors
Once in a
who
way
are
taking
attending.
is nothing. Anything in moderation is okay.
Right, sir. We will move on to 3rd topic, HbA1c and heart disease by Professor Dr. R.S. Hariharan. R.S. Hariharan sir is known to all of us, teacher of mine and teacher of many of us, teacher of teachers.
Gentlemen, at the outset I would like to thank the organizing committee and Dr. Shanmugavelu and others for giving me this opportunity to talk to you this morning. Respected chairpersons, thank you for the kind introduction. I will be speaking to you on hemoglobin A1c and heart disease. Now, is it the same as diabetes and heart disease? What am I trying to address when I talk about hemoglobin A1c and heart disease rather than diabetes and heart disease? You can only compare it to, is diabetes a heart disease or a diabetic disease? Now, do you know that before the 1990s, hyperglycemia was not believed to contribute to cardiovascular disease and type 2 diabetes? In fact, if you look at the classification of heart diseases in the textbook of those days, you would find something like congenital heart disease, rheumatic heart disease, atherosclerotic heart disease, hypertensive heart disease, syphilitic heart disease, and so on. But is there a diabetic heart disease? This was never mentioned in those books. It was not in existence at that time. Now, this is Miles Fisher, who said diabetes should be defined as, now let us look at the definition that we used to have as far as diabetes is concerned from Professor Sam G.P. Moses' days. You say diabetes is a metabolic cum vascular disease due to relative or observed insulin deficiency characterized by glycosuria and or hyperglycemia and associated with complications such as microvascular complications, retinopathy and nephropathy and macrovascular complications. It's an elaborate definition. But look at this gentleman who says diabetes probably should be redefined as a state of premature cardiovascular death which is associated with chronic hyperglycemia and may also be associated with blindness and renal failure. So he literally relegates retinopathy and nephropathy to the background, highlighting the fact that diabetics often die a cardiac death, whatever be the underlying complication. Even renal failure patients quite often die of a heart failure or a heart myocardial infarction rather than renal failure. Now that's what exactly is the crux of the problem. Now, if you look at the slide, it elaborates the involvement of the various structures of the heart due to diabetes. You know that diabetes is a metabolic cum vascular disease. The vascular one is microvascular and macrovascular. The metabolic complications as far as the heart is concerned is the result of metabolic arrhythmias, either due to FFA when there is uncontrolled hyperglycemia or of course hypoglycemia in the other extreme. As for the vascular complications, the macrovascular is the time-honored macroangiopathy, coronary heart disease, and microvascular angina is angina despite normal coronaries. Diabetic cardiomyopathy is also a microvascular complication of diabetes, and cardiac autonomic neuropathy because of microvascular neuropathy of the heart, which is reflected by your cardiovascular reflexity, is yet another complication. So diabetes affects each and every part of the heart. Now, if you look at the history of hemoglobin A1C, it was virtually an accidental discovery in 1968 by Samuel Rabar, who discovered that hemoglobin A1C is elevated in diabetes. He was just looking at the hemoglobin A1C, all patients. He said all diabetics seem to have a higher hemoglobin A1C. That is why hemoglobin A1C was discovered at that time. It was Anthony Cirami in 1976 who proposed that hemoglobin A1C be used for monitoring glycemic control in diabetics. Subsequently, in 2010, ADA recommended the use of hemoglobin A1C to diagnose diabetes, pre-diabetes as well as stress hyperglycemia. So, Cirami introduced it for monitoring control. ADA recommended for diagnosis of diabetes, pre-diabetes and stress hyperglycemia. Now, we do have today a third dimension to hemoglobin A1C, that is hemoglobin A1C and heart disease. Cardiovascular diseases, as you know, rank as the number one cause of mortality in the world. 31% of all global deaths are due to cardiovascular diseases. More than 70% of patients with type 2 diabetes die of cardiovascular causes. It is therefore imperative to identify and control the various risk factors if we were to prevent cardiovascular diseases. So, looking at the CV risk factors, we are all familiar with the traditional risk factors which are either modifiable or non-modifiable. Modifiable meaning blood pressure, lipids, diabetes, BMI, smoking, etc. Non-modifiable is of course the age and gender. Today we talk about novel risk factors, out of which HSCRP is well established now. We are now talking in terms of whether hemoglobin A1C is also a marker for cardiovascular risk. Now, glycemic control and complications of diabetes. This ADA-AHA-ACC recommendation says, as far as microvascular complications are concerned, glycemic control is a class 1 recommendation. There is abundant epidemiological RCTs that confirm the benefit of glycemic control as far as the microvascular complications are concerned. But when it comes to macrovascular diseases, it's only a class 2B recommendation. Effect benefit with level evidence A, less well established by evidence or opinion. So that's as regards the macrovascular complications of diabetes is concerned.